I'm Jodie.
My name's Rachel.
And we're veterinary nurses at Havering Vets. Today we're just going to give you a quick demonstration on how to inject a diabetic patient. Joey here has kindly volunteered. He's not diabetic, but we will demonstrate on how to inject with water, so we won't be doing him any harm at all. With diabetic patients, when they're first diagnosed, myself and the vets normally clip a patch of hair at the back of the neck, just normally between the shoulder blades, and that's ideally where he should be, or any diabetic patient should be injected. So you can see there he's just got a nice clip patch, and that's just to get the owner used to injecting in the same area really. And obviously you can see Joey's got a very long coat, so you can just make sure that you're injecting properly and that none of it's spilling out or you're getting it on the coat or anything like that. So, so he's nice and clipped ready. So I'm going to get the insulin out the fridge because that's where it's meant to be stored at all times. So I'll get that now. And then once out the fridge, just to make sure that it's mixed completely, you should invert the bottle a couple of times. Do not shake it, it should just be inverted, okay? And with your insulin syringe, you should just take the bottom off there so you can pull the plunger back and take the needle cap off, and then very carefully put the needle into the bottle, and then double check and make sure how much of a dose you are drawing up. And then, so say we were going to give him 5 units, just draw back to 5, and if you get any air bubbles, you just simply let go of the syringe, and it shouldn't fall out the bottle. Just give it a couple of flicks, and then all the air bubbles should go to the top, where you can just push them out a little bit. Okay, and then just take the syringe out of the bottle. So I have got my sterile water here, which we're going to inject into Joey, and this won't do him any harm at all. So Rachel's just restraining him there, but he's been very good. So if you take the cap off, and then with your 3 fingers, ideally, you can make a little tent. So where he's just clipped up there, you can pinch the skin and pull it up, and you should have a nice little area there where you can pop the needle into. It's a very fine needle, so they don't normally feel it. So then you just draw back, just to make sure they're not in any blood vessels, and then as long as everything's okay, you can just slowly inject that there. And then once done, you take the needle out and just give it a bit of a rub and make sure that it's all gone into the skin, which it has done. And then you can put that in the sharps bin safely. So that's how easy it is. If you have any questions at all, then please don't hesitate to give us a call or to pop into one of our surgeries.